Hi, welcome to Talking About It. I'm John Griffith. Cara is off social distancing somewhere. Hopefully she'll be back soon. Um, I am joined today by Damon Jacobs, who is an expert in all sorts of things, but relationships and intimacy and good health are some of his specialties that he's talked about on this program before. So I want to welcome you, Damon. Welcome.
Thank you, John. It's so good to see you again, even if it's through a screen. I'm so happy to see you.
That seems to be the way things are going. I hate the phrase "the new normal." I hate in these uncertain times, which is in every other advertisement right now. But there's unfortunately the element of truth to them. But yeah, as things ease up, restriction-wise, and as governments ease things up, COVID isn't going anywhere.
No.
Yeah, the numbers are on a roller coaster depending on where you are. You're currently in New York, where the numbers are significantly reduced, and I'm sitting here in Florida, where it's the opposite tail.
It's really weird. We went from being, the hotspot danger zone in this country to now being one of the lowest, if not the lowest state with the lowest rates at this time. It's very strange, but I think we're all trying to contemplate in New York City how not to be sitting ducks and how to prevent the spiking from happening again, since it seems to be happening so many other areas.
Yeah, I think you relax, you get complacent, and you forget your basic precautions. And that parallels to some of what we're going to be focusing a little bit more on today in this talk is life does go on through all of this, and we have to navigate our way through the world, and that includes relationships and intimacy and getting to know people and or just getting to be with people.
Yes.
In whatever manner you want to take that.
Yes. Well, or the phrase that I'm using is conscious connection.
Okay.
Consciously connecting with people. To be really mindful and aware to the best of our ability of how we connect with each other. Because I don't think it's really fair or just or possible to tell human beings not to touch each other indefinitely. Mm-hmm. I'm not just talking gay sex, I'm talking about human beings in general. We know that babies need to be touched in order to thrive, right? Hospitals have volunteers who do that, because if a baby's not touched enough, it will not thrive. And when does that stop? At what age do we not need touch to thrive? I don't think we ever stop.
I don't think most people don't stop.
Right. So we are really challenged here to think about how to do that with a harm reduction model within the confines of understanding the science, but also the human need for connection and touch.
Okay. And it's that plays a lot into I see people who have I don't want to say ignored the current situation, but who've just navigated as they always have. And
navigate what?
Navigate sex relationships, hooking up, and just being around people in general. It's funny. It's like the individual I'm talking about has children, and they are divorced. So this person has stayed away from his children for their own protection, but everywhere else in his life he's navigated as though I can't crawl into his head, so I can't say completely as nothing has changed, but it's still on the app, still having his normal connections, whether with regulars or new people. And it's so easy to be judgmental in this time, and it almost takes an effort not to be. Actually, it does take an effort not to be, because you have so much being drilled into your head from so many different sources. And it's a little bit different than just doing the common sense thing and putting on a mask. It's much more complex when you're dealing with the need for touch, as we started with, and intimacy and relationship and sex.
Yeah. I think if ever there was a time to truly practice empathy, this would be it. And when I say empathy, I don't necessarily mean agreement. But I think the go-to for so many people is to look outside themselves and judge and criticize and shame and finger point and use the word should. And I don't really see that having an effect on people's behavior. As a matter of fact, in my experience of almost 30 years in this field, in the mental health, social work field, I've seen it go the opposite. That when you shame people, when you humiliate people, they usually build resistance to that. Mm-hmm. And then may do the opposite then just to spite you, because now you've created opposition, you've created resistance to that. Right. And so the realm that I've often worked in as a mental health worker and within substance abuse and harm reduction is working collaboratively, trying to find that common ground. And it might mean that I might be trying to find common ground with someone who I don't necessarily agree with on many things. Maybe I don't even like them very much. But I know that if we're going to have a greater health outcome and our community is going to have greater health outcomes, it means that we have to find a way together to find common ground and collaborate on decisions. And I don't see a whole lot of that happening on any level right now. I don't see that happening on the community level, on the health level, definitely not the political level. There's just not that happening. So we have this situation where the medicine and science are not clear from day to day. We're hearing new things every single day about what to do, what not to do. Obviously, the politics are all messed up. We don't have any leading. And now this whole thing about masks has become a partisan issue, which is very, very dangerous to do, to make a health issue a partisan issue. And we don't have anyone actually applying social psychology to the messaging. Instead, we have shaming and shoulding. That will not create change. That is something I've learned from the HIV epidemic. This is, the work I do, sexual health, HIV prevention. We saw that U equals U and messages around PrEP were different because they weren't about shaming people and telling them what not to do with their bodies. They were like, humanity, compassion, science, facts can guide your better health decisions. And once we saw people doing that, what happened? We started seeing a trajectory of HIV new diagnoses in the US come down. Mm-hmm. When we started using data and facts and compassion and evidence and all that stuff. So you can cut me off because I could go on about this. But I just feel like the HIV, they're very different as far as the virus, HIV and AIDS and COVID, very, very different viruses. But some of the issues from my therapy practice and from social health medicine messaging, I think, are very similar.
Oh yeah. There are the mental parallels, not the viral parallels.
Right. Medically, they're very, very, very different things.
Well, I think a lot of times the best thing that we can do is arm ourselves with whatever knowledge is available. Mm-hmm. And as far as navigating certain things, it's like you find the reliable science, and you find out how to protect yourself best in doing what you're going to do.
Mm-hmm. And the really hard part about COVID is that I don't have science or facts to guide me and my community. When I say my community, I mean my community, my colleagues here in New York, my clients that I see in my mental health practice, mm-hmm. as well as the community that I know from the Facebook group where I run this group about PrEP and U equals U, where we talk about HIV prevention around the world. It's really become a contentious issue about sexual connection and human touch among COVID. And the problem is, unlike U equals U, unlike PrEP, where we have science and facts to guide these discussions, we don't have solid science and facts to guide this discussion. Right. So what I'm doing, and John, I welcome your input, and certainly anyone who's watching or listening can contribute, but we're creating some ideas or questions people can ask in terms of negotiating sexual or human touch and connection while mitigating or minimizing risk.
Okay.
For instance, if I'm considering meeting somebody or touching somebody or sexually connecting with somebody, one of the questions I ask is, have you had any signs or symptoms of COVID in the last 14 days? A fever, a cough, loss of smell, taste, anything like that?
Okay.
The answer is no. To the best of your knowledge, have you had any direct contact with anyone who has been symptomatic for COVID, or been within 6 feet of anyone who's been symptomatic for COVID in the last 14 days? Yes or no? Let's say the answer is no. At this time, do you live or work with anyone statistically at higher risk of dying from COVID? Are you living with a grandparent? Are you a caretaker? Are you someone, if you were to get COVID right now, could someone else's life be at imminent risk? And I think that's an important question.
Yes.
If the answer is no, then I ask one more question that, have you been tested? When was the last time you were tested for COVID? Did you get the virus, the antibody test?
Mm-hmm.
And let's say they're like, yeah, I got tested and it was 2 weeks ago and it was negative for both the virus and the antibodies, and the answer to all those questions were no. Then it seems to me that we can rationally and reasonably ascertain that this will be a safer person to connect with. Not safe. I'm not saying anything's safe. There's nothing safe in COVID, but going to the grocery store isn't safe either. But if I'm going to consider sexually connecting with someone, these are the questions I ask. And I'll tell you this, John, the very first group, or the very first individuals that I considered asking these questions to, were partners I had been with in the past who had told me in the past that they had an STI.
Okay.
Because they had shown me that they have integrity, character, honesty, and that they're not just going to tell me something, yes, because they want to get laid.
Right.
That if there's a problem, they're going to be as open and honest and transparent with me as they can be. And that, to me, is the mark of a person with integrity. And that was who I started reaching out to during this COVID crisis. So I think there's ways to mitigate risk, but there's certainly no way to eliminate risk, sexually or otherwise, while we're dealing with this pandemic and this very, very, very tricky, insidious virus.
Right, and it's going to be with us for the foreseeable future.
It sure appears that, yeah.
I mean, you go back 100 years, the flu epidemic was a 2-year epidemic. So, there's a strong chance. I mean, modern science, God willing, will shorten that for us, but you never know, and you have to prepare yourself and navigate as if.
Yeah.
And it's finding that core group of or even just one person that you can trust and move forward with. That can probably be very freeing for a person. At least, the first one, I'm sure, is a very freeing experience.
What's so interesting is that I will tell you my experience, and this has been echoed by many other people in New York City right now, perhaps in your area. The sexual connections feel deeper, relevant, meaningful, more so than before. I'm meeting guys who are interested sexually, but more than that, or equally, they just want to be touched. They want to be held.
Mm-hmm.
They need that. We all need that. And New York City, especially if you don't have a primary partner or you live alone, we're now in our 4th month of this.
Right. That's
and
alone time.
People are starved for touch. That's literally a medical phrase that we're learning more about, is touch starvation. People are starved for touch. And so I'm learning, and there's really something interesting and kind of rewarding for me in kind of reconnecting with some partners who really, really, really are craving touch, even more so than sex. And it reminds me, like when I first came out of the closet in 1989, and that was like right in the middle of the AIDS pandemic. And I remember then that I was meeting these guys. I was in San Francisco and, running around the Castro, and I was meeting these guys who had been there for the first part of the AIDS crisis and had seen so much tragedy. And so many of the connections then were also about touch. I mean, I rarely remember having anal sex back in the late 80s or early 90s. It just wasn't really something people did a lot of, at least not in my life. It wasn't really something on the front of the menu. It was more about connecting and touching and kissing, because that's what people really needed. And there was still so much fear about anal sex back then. And in some ways, I do feel like that's that level of intimacy and connection is being really craved for right now.
Well, I'd say even when I was single, that there were many times when I would prefer a good hug and a makeout session over a quickie whose name I'm never going to remember.
Yeah, yeah. It's again, it's an interesting time. Now, what I'm telling you right now, John, I think you're very cool, but I know some people may listen to this and go, "Oh, he's so selfish. That's so selfish. Oh my God, he must be sick. You know, how dare he? How dare he leave the house? How dare he connect with other people?" And if somebody's having that reaction, I really invite them to slow down, breathe, and think about if something I'm saying sounds offensive or inducing anger, to just do a little inventory and see, well, what's coming up around that? Is there a part, if someone's upset by this, is there a part of you that really wants to be able to do this, maybe hasn't allowed yourself to do this? Or maybe you're in a position where you yourself might be statistically at much higher risk. If you contacted COVID, you know, it could literally be life or death.
Right.
If you are, of a person who might be in a more vulnerable medical position. So
Right.
I understand that people may get angry about this subject we're talking about right now. And again, my invitation and hope is that they will use that to just like, okay, you can be mad at that annoying guy, but you can also go within and really think about the buttons and the issues that are being triggered for you right now. And with that area, there's room for growth and learning. That doesn't necessarily mean being happy or joyful, but learning and developing. And what I'm trying to do in this whole COVID thing every day, with everything changing and so much spinning out of control, is I'm just trying to learn. I'm trying to observe. I'm trying to grow and figure out how I can be a better person than I was before all this started.
Mm-hmm. Well, I mean, in addition to what we're talking about right now, there's so much going on in the world that relates specifically to people becoming better people, and that's a topic for another show. But it's a small fraction that does relate to what we're talking about. You know, it's like listen and learn.
Right, and maybe withhold that urge to type something really mean and push send. Try to withhold that. Just like see what happens if you don't leverage that insult, that criticism,
Right.
that name calling against someone you disagree with. We are being called upon. You know, the blessing and the curse is that this is happening in the age of social media. And in a lot of ways, that's a blessing because we get to have these conversations and we still get to see people we love, even though we can't be in the same room with them. That's good. The downside is that everybody in the room, everybody in the world with a Wi-Fi connection has access to saying some pretty horrible, terrible things to each other. And
I'm a recovery person, and there's a saying within that: say what you mean, but don't say it mean.
I love it. Yeah. I say we can disagree without being disagreeable.
Mm.
I stole that from Barack Obama. So. But that's, it's really what he lives by. And what I have learned from his actions is exactly what you say. It's okay for us not to agree. I've been talking about PrEP openly now for 8 years, so I'm used to people getting very angry with me and saying horrible things to me. I'm okay with that. But
Right.
I also do encourage them, even back then, to go a little deeper with that and say, what is coming up for me? What wound, what trauma is being provoked and triggered by such open discussions about condomless sexuality and liberation? So I put that out there to you, to the world, to your viewers, just to think about that. We do have an opportunity. I mean, I know there's a lot of tragedy and I'm really sad about what's happening, but I'm really also curious to see where we go from here. And if there's an avenue by which we are all going to survive with deeper compassion and respect and integrity and love. I'm always like this optimist where I think that's possible.
Well,
What do you think?
I do try to keep the most positive outlook toward things, and it's like I do have hope for treatment and vaccine. But it's not here now, so we have to act as if, and continue living our life, but do it and navigate that line as safely as we can.
Yeah. Yeah.
But it sucks sometimes. It sucks sometimes.
It does. It does. But it really is hard. It's really, really hard. I don't think I've ever seen something so globally traumatic happening in my lifetime. I'm almost 50 and I feel like the only frame of reference I have for any of this in terms of community trauma is the AIDS crisis.
Right.
This feels even bigger and more global than that. And what if for people who are interested or have studied Buddhism or some Eastern thought, it is often through these periods of suffering that humanity gets closer to enlightenment and evolution, if we use this pain to grow and learn.
Right.
Then there's opportunity to get closer to enlightenment.
I mean, just in general, I see people taking certain things back that have gone by the wayside. I see families taking walks together. I see families doing more things together than just getting locked in front of a tube. In front of the screen. The screen time is not the only time that they're spending together now, which is the blessing in all of it.
Yeah. It's interesting.
Yeah. That's half full part of the glass.
We have, I know Andrew Cuomo is a bit of a controversial figure, and I would say I don't always agree with everything he says, but what an amazing, amazing example of leadership. And that's one of the things he says. It's like, I'm getting all this time with my family now that I don't typically have, that usually the teenagers would just run around and I never see them. And now I'm getting all this time to spend with them. And that's going to be time I'm always going to look back and be glad that I had.
Right.
That's according to Andrew Cuomo. Now, you ask me, Damon, I'll tell you, I have never been more glad that I don't have kids than now. And I'm not putting it down. I love, and I think parenting is the most amazing job, and I love and respect anybody who can do it, who wants to do it. But I've just been like, I am very, very grateful that my 4 months of lockdown in Brooklyn have been relatively quiet, calm.
So, well, that's what's getting you through the day. And it's like everybody has their own road.
Yes.
But to those who are really trying to navigate, the needs and desires that we've been talking about, aside from those questions that you would ask a potential partner, and we all have our own barriers, and it's like many people, like we discussed the possible shaming aspect of that goes on. There's also self-shaming. And how do when we build those barriers for ourselves, how do we break them?
It's going to sound like a cliche, but I mean, that inner process starts with love. I know people can go, oh, good God, he's going to talk about love. If not love, then like. We want to break down shame, because once we get into that realm of inner and outer shame, now we have all these barriers to having authentic discussions and conversations about making better health decisions. Mm-hmm. So once we get people who feel bad and guilty about themselves and about their human need for touch and connection and sex, and you've created a culture around you should feel bad about that, and I'm saying should in quotes because I wrote a book about the word should, oh my God, this is so awful, and people calling each other out in the social media realm. Now you've created resistance. Now you've created shame. So now people like me, or people, the doctors and the nurses out there that are really trying to help people, have an extra barrier of how they help people if someone can't even ask for help or talk about what it is they want help with. It's just, it's astounding to me that we're still doing this. I say we, I don't mean like just the gay community, though it's a lot in the gay community. But what if we thought about it in terms of a different angle? Let's start from a loving place. And in that loving place, we begin here and we recognize sexuality inherently is beautiful.
Mm-hmm.
That consensual connection is healthy. And that touch, human touch, is necessary. And we use that to think about creating a culture in which we build each other up instead of tearing each other down. Where instead of calling out behaviors, we call in. That we invite people to do better, to learn and do better. Because we are all capable of doing better, all of us. Mm-hmm. And when we call that in as a community from a place of love, from a place of humanity, from a place of compassion, people do better. That's what I'd like to see, John. That's what I'd really like to see. That is, I think, the opportunity that sits before us.
Okay. Yeah, it's a tremendous opportunity for growth and understanding.
Yeah.
And yeah, so the day that I stop learning is the last day of my life, because I always want to be curious and I always want to be learning and I always want to be striving to be the best me that I can be.
Yep. Me too. Me too. I think as long as there's an ability to learn and grow, to me, there's meaning. And I think that's the other thing that's helping me get through this whole COVID thing, is just kind of referring to writings and philosophies that other people have used to get them through very extreme circumstances. Historically, specifically, I'm thinking of a book called Man's Search for Meaning, written by Viktor Frankl, who was an Auschwitz survivor. And I'm not comparing COVID to concentration camps, but this ability that even in the most extreme circumstances, that human beings can find serenity by saying there's meaning in what's happening right now, even if I don't fully understand it, but there's meaning in what I'm going through. And in my mind, Damon's mind, if I'm growing, if I'm learning something new, then there's meaning.
Right. I agree. So just to kind of boil down, a lot of in the last couple of minutes that we have, just to kind of work through some of what we've discussed. I mean, it's like there's a lot that we can do to get the physical contact, the physical and emotional intimacy, and that starts with arming ourselves with the knowledge and asking the right questions of a potential partner, date, however you want to proceed. Making an old friend new again, however you want to proceed. Mm-hmm. So,
yes. And washing your hands.
Yes.
Cleaning, if you have somebody at your house, clean the surfaces. You may want to wash the sheets afterwards if you have sex. If you have a thermometer, take their temperature, take your own temperature regularly, things like that too.
Right. And I've noticed a lot of my friends who, when things went into lockdown, okay, well, I'm not going to be going near anyone, so I'm going to stop prep for a while. Mm-hmm. So it's if you're planning to get back out there, get back on prep.
Yeah. So, I mean, again, this is where we want to be able to have these conversations without shame. Mm-hmm. Because what's happening is, what I'm seeing in my group, the global group on Facebook, is that a lot of people said that at first, like, okay, well, there's no way I'm going to have sex now, so I take PrEP. Well, medically that makes sense. But then human beings, or at least a lot of human beings, are not very good at predicting their sexual behaviors very well. Mm-hmm. So what we're seeing now is a lot of people getting on the page saying, uh-oh, what do I do? I had sex. Is PrEP going to work? Well, no, PrEP is pre-exposure prophylaxis. So what you need now is PEP, post-exposure prophylaxis. And, we help people get that. We help people learn about that as well. But for me, when all this fell, when all the COVID stuff started in March, I, for the first time in 9 years, stopped using PrEP because I knew that I wasn't going to have sex. I didn't want to have sex. I just wasn't interested. Around mid-April was when I started having those conversations that I told you about. Started reaching out to some people I knew, partners that I was aware of.
Right.
And I started using PrEP on what's called the on-demand basis, or what's sometimes called 211. That means that if you're not having sex very often, but you know you're going to sometime in the next 2 to 24 hours, you can use it for just, PrEP can be 99% effective for that one time if you use it the right way. If I may tell just very briefly. So let's say it's 8 o'clock on Friday night and I have a date at 11 o'clock. I'm going to take 2 doses right now, 2 doses of Truvada. Truvada is the only drug we know this works for. We don't know if it works for Descovy. 2 doses of Truvada right now. If I have sex and possibly may have been exposed to HIV tonight, what I'm going to do tomorrow, Saturday night at 8 o'clock, very close to 8 o'clock, take 1 more dose of Truvada. And then Sunday night at 8 o'clock, take 1 more dose of Truvada. And if I'm not having any more sex and I'm not having any sex in the foreseeable future, good. I'm good to go. I have been protected for that one event.
Okay.
That is what the data science shows us. So there's 2 ways to use PrEP. One is daily, where you don't really have to worry about the time. You just have to make sure it's consistent. And then the other one is the event-based 211 dosing, if you're not having a whole lot of sex. And they're both scientifically valid, proven strategies across the globe.
Okay. Well, you taught me something today.
Yeah. Cool. Good. So I was doing event-based dosing for a while, and then around late May, I realized, you know what? I'm having more regular sex with some partners who I know, and we're getting tested now for COVID. Now we have testing in New York City, so now we can all get tested. Everyone can get tested regularly, so we're all doing that regularly. And I also just psychologically appreciate the daily dosing for PrEP, because as someone who is HIV negative and now been sledding around for 31 years as a bottom, why not? I do like the mental health effects of PrEP, which is that whether I'm having sex or not, I like knowing that no matter what happens today or who it happens with, the one thing that I can be sure of is that HIV is not going to enter my body. And that is the mental health aspect of PrEP that also is one of the reasons people use it. So I would encourage people, if you've been using PrEP, just to learn about all the different methods for doing it. If you stopped using PrEP, but you know you got a hot and heavy date coming up, learn about 211, Google World Health Organization 211, come to my group on Facebook. It's called PrEP Facts, Rethinking HIV Prevention and Sex. It's on Facebook. We have 21,000 global members, and we talk about these things every day and night. And you can learn more about event-based dosing, daily dosing, and ask any questions, personal, or anything you want to ask about PrEP. We go there.
And is that the primary place where people can find out more about you and what you do?
That's pretty much, if you want to find me, that's where I'll be. I don't. It's a passion or an addiction. I don't know which. I've been on this page every day and night for 7 years now. So whatever you want to call it, this is my version of a child. This is what I give a lot of attention. So they can find me there, or if you go to DamonLJacobs.com, you can also see my therapy work, the books I was talking about.
Which you're doing online now, so if people want to have a professional conversation with you, that's where they can find out more about that.
Absolutely. This is kind of new for me because I was never a therapist who liked to do online stuff, but now I've gotten really used to it, and I think everybody is doing therapy online. So if people are interested and want to ask me about that, send it, bring it. Damon L Jacobs, Damon at DamonLJacobs.com, or just go to my website or the Facebook group. And if you're not annoyed by me now, you will be after a few therapy sessions. Reach out.
Well, I'm not annoyed by you, but we're just about out of time. So I really want to thank you for taking time out of your schedule to chat with me. Hopefully, at some point in the near future, we can get ourselves in the same room again.
We're going to get back to that studio in Queens, and I'm going to give you a big hug and sit on your lap, and we're going to, at some point, we're going to connect again.
I know we will. And thank you so much. And check out Damon at his website, and there are more shows at our website, talking about .info, which takes you right into our YouTube page. There's a couple of hundred shows up there, even a few with Damon, who's been on the show numerous times. So
Yeah.
thanks very much, and I will see you next time. Bye.
Bye, darling. Thank you.